What if you could accurately determine your diabetes risk at home in just 5 minutes? Without any blood sugar meter? Did you know that over half of the 3 million people newly diagnosed with diabetes each year ignored warning signals their bodies had been sending for years? Even more shocking is that specific signals your body produces when detecting blood sugar abnormalities can appear up to 3 years before blood glucose tests show problems. By the end of this video, you'll have a complete self-diagnosis system to accurately assess your diabetes risk and take early action before visiting a doctor. The hidden science of pre-diabetes symptoms. Before diabetes develops, an amazing adaptation process occurs in our bodies. As blood sugar gradually begins to rise, each organ system starts responding to these changes. The symptoms that appear during this period are exactly the early warning signs of diabetes. However, most people mistake these initial signals for simple fatigue or aging. In reality, the body is desperately warning that a diabetes tsunami is approaching. Yet these crucial alerts often go unnoticed. Medically, this is called pre-diabetes or impaired glucose tolerance. Taking appropriate measures during this stage can prevent progression to actual diabetes by up to 85%. Not missing this critical window becomes the turning point for lifelong health. Visual signals for diabetes risk assessment. The first self-diagnosis method involves visual changes. You can check in the mirror. Examine these specific indicators carefully. If dark patches appear on your neck and armpits, this indicates acanthosis nigricans. When insulin resistance develops, skin thickens and darkens, creating one of the clearest visual signs of pre-diabetes. Wounds on toes and heels that heal slower than usual are important signals. High blood sugar impairs circulation and weakens immune function, delaying wound healing. If minor cuts don't heal within 2 weeks, consider diabetes screening. Frequent gum swelling and bleeding is an easily overlooked sign. Elevated blood sugar promotes bacterial growth in the mouth, triggering gum disease. Periodontal disease and diabetes create a vicious cycle, worsening each other. Detecting changes in smell and taste. The second method involves observing sensory changes. Early diabetes produces subtle sensory alterations that, when carefully monitored, enable early diagnosis. If your mouth frequently feels dry, and you experience intense sweet cravings, pay attention. When blood sugar rises, your body demands more fluids to dilute it, while your brain craves more sugar simultaneously. Numbness or reduced sensation in fingers or toes signals potential nerve damage. High blood sugar begins damaging peripheral nerves, with extremity sensory abnormalities as the first symptoms. If your sense of smell diminishes or food doesn't taste the same, this could also indicate pre-diabetes. Blood sugar abnormalities affect brain nerves, reducing sensory function. Sleep pattern and energy level analysis. The third diagnostic approach involves observing sleep and energy changes. This method is highly accurate and easily verifiable. If nighttime bathroom visits increase dramatically, this represents a classic early diabetes symptom. Kidneys produce more urine to dilute high blood sugar. Urinating more than 8 times daily warrants diabetes suspicion. Experiencing extreme fatigue 2 hours after eating is another crucial signal. Normal individuals maintain stable post-meal blood sugar, but those at diabetes risk experience severe fatigue from dramatic glucose fluctuations. Feeling unrested despite adequate sleep and frequent daytime drowsiness may indicate sleep quality deterioration from blood sugar dysregulation. Weight and appetite change pattern analysis. The fourth method analyzes weight and appetite changes. Early diabetes produces characteristic patterns in these areas. Losing weight despite eating normal or increased amounts signals serious concern. This means your body has started breaking down muscle and fat for energy because it cannot properly utilize glucose. Conversely, rapid abdominal weight gain with increasing waist circumference indicates insulin resistance. Men with waist measurements exceeding 90 centimeters and women over 85 centimeters face dramatically increased diabetes risk. Uncontrollable sweet cravings also warn of problems. When cells cannot properly absorb glucose, your brain continuously demands more sugar. Skin and hair changes assessment. The fifth method examines skin and hair changes, which women may notice particularly sensitively. Women may develop hirsutism, with increased facial hair around the chin or mouth. Insulin resistance disrupts hormonal balance, increasing male hormone production. Frequent itchy, dry skin and unexplained inflammation or rashes may indicate pre-diabetes. High blood sugar weakens skin immune function, triggering various skin problems. Hair loss exceeding normal amounts or thinning hair may signal nutritional supply disruption from blood sugar abnormalities. Simple blood pressure and pulse checks. The sixth method involves simple home blood pressure and pulse monitoring. Blood sugar and blood pressure are closely related and influence each other. If your blood pressure has increased beyond previous levels, consider diabetes risk. Particularly concerning is systolic pressure above 140 mm of mercury or diastolic pressure above 90 mm of mercury in previously normotensive individuals, becoming breathless or experiencing rapid heartbeat from minimal stair climbing may indicate cardiovascular changes from blood sugar abnormalities. When checking your wrist pulse, irregularity or faster than normal rhythm may suggest autonomic nervous system dysfunction. As diabetes affects autonomic nerves, digestive symptoms for diabetes detection. The seventh approach observes digestive symptoms. Diabetes affects the digestive system in various ways, enabling early diagnosis through these changes. Persistent post-meal bloating and poor digestion may indicate diabetic gastroparesis. High blood sugar impairs stomach motility, causing food to remain longer in the stomach. Alternating constipation and diarrhea or chronic constipation may signal autonomic nervous system dysfunction. Diabetes affects nerves controlling intestinal movement. If your breath becomes sweet or fruit-scented, this represents an extremely serious signal, indicating possible ketoacidosis, requiring immediate medical attention. Cognitive function and mood changes. The eighth method observes mental and cognitive changes. Blood sugar abnormalities directly impact brain function. Declining memory and inability to maintain concentration may indicate insufficient glucose supply to the brain. These symptoms are particularly suspicious when related to meal timing. Unexplained increased irritability and persistent low mood may also relate to blood sugar fluctuations. Blood sugar instability disrupts neurotransmitter balance, causing mood disorders. Sudden vision blurring or eye haziness may result from blood sugar affecting the lens. Intermittent occurrence of these symptoms strongly correlates with blood sugar changes. Family history and lifestyle risk calculation. The ninth method comprehensively evaluates personal risk factors. Genetic and environmental factors must be considered together for accurate risk assessment. Having diabetic parents or siblings increases diabetes risk 2 to 6 times. Risk becomes even higher when both parents have diabetes. Age is also crucial. After 45, diabetes screening is recommended every 3 years, with more frequent testing if risk factors exist. Women with previous gestational diabetes or who delivered babies over 4 kilograms face increased future diabetes risk. Women with polycystic ovary syndrome also have elevated insulin resistance risk. Simple physical activity testing. The 10th method measures diabetes risk through physical activity. Diabetes affects muscle glucose metabolism, detectable through exercise capacity changes, becoming significantly breathless or experiencing leg weakness when climbing 2 flights of stairs may indicate reduced muscle glucose utilization. Particularly concerning is noticeably decreased exercise capacity compared to previous levels. Frequent dizziness when standing from sitting may signal orthostatic hypotension from blood sugar changes. Diabetes affects the autonomic nervous system, causing these symptoms. Weakened grip strength making bottle cap turning difficult or awkward chopstick use may indicate peripheral nerve abnormalities. Comprehensive risk assessment system. Now let's comprehensively evaluate Personal diabetes risk using all previously checked items. This scoring system calculates total points for risk assessment. Score 3 points for 3 or more visual signals, 2 points for 2 or more sensory changes, 2 points for 2 or more sleep and energy changes, 2 points for 2 or more weight and appetite changes, and 1 point for 1 or more skin and hair changes. Out of 10 total points, 7 or more indicates high risk, requiring immediate medical examination. 4 to 6 points suggests moderate risk, needing lifestyle improvements and regular monitoring, and 3 or below represents low risk, but requires preventive management. Add 2 points for family history, 1 point for age over 45, and 2 points for abdominal obesity. If today's diabetes self-diagnosis methods helped you, please subscribe, hit the like button, and turn on notifications to receive more healthy living information as quickly as possible. We support your healthy choices.